uh, Samuel Tadessa from Ethiopia Ministry of Health, who has been coordinating the ongoing maintenance activities on the ground because, following this COVID pandemic, the Ministry of Health has been, working so hard on the ground to support the ongoing maintenance activities. So they have their own approach, and they are, leading these maintenance activities on the ground. And Samuel has been one of the, the three BMEDs from the ministry side who had been, actively supporting on the ground. So I don't have them here today, but also there is Zarihun and Tadessa, who are also, coordinating this maintenance activity. And thank you, Samuel, for being available, this late to be able to share your experience to this group. So thank you very much. And with this, I forward it to Samuel.
Yeah, thank you, Mas, for the introducing me to the team. Then I can proceed to the experience sharing, what's going on here at the Ministry of Health and the tasks that have been performed in the past for 3 months by the ministry and the supporting partners. As Dr. Masrashau said, that most of the tasks that have been performed are focused on maintenance activities. This maintenance activity focus on specifically medical equipments which are selected by WHO for COVID case management. Starting from the first week of March, that's the week that we have recorded the first case of COVID-19. The ministry has organized a voluntary maintenance activity by collaborating with partners like Assist International, Addis Ababa University, Tekbared, Polytechnic College, Addis Ababa University, and other institutes, the Ethiopian National Meteorology Institute. So far, let me share you some PowerPoint that has been prepared before a month ago for a management meeting. And okay, this is a bit older report PowerPoint, but it helped me to talk about it right now. Okay, it says about the medical equipment team at FMOH activity on COVID-19. First of all, that this is an acknowledgement part for the volunteers that have been participating in the maintenance activity, for institutes which they offer their workshops, availability of other supplies, parties, and then other stuffs. So as I told you, there are 3 emergency maintenance centers organized by the ministry. The first one is Addis Ababa Polytechnic College, Tekbared, Ethiopian Airlines. He already gave us the aircraft maintenance workshop for maintaining medical equipments. And the National Meteorology Institute. So there are biomedical engineers, technicians who has been participating in this maintenance activity so far. And there are 8 team members of biomedical here in the ministry to coordinate other activities with us, which support the activity that have been implemented to manage COVID. This is just a number which shows how many medical equipment have been delivered to the sites. With them, there are ventilators, defibrillators, as you see. This is the items which have been received from Addis Ababa hospitals, regional hospitals, and a total of them. And finally, we have collected about 108 from the Addis Ababa and 129 in total of 237 equipments. This is a bit older, but I don't have the time to prepare the new data. Just this is enough for that. Then some of them are maintained, and we already calculated the financial estimation for that, taking the information from the suppliers, and also we have already requested some of the ventilator suppliers to maintain for us, but they won't do that because they already requested too much financial payment for that. So we use that information to estimate this uh, uh, financial estimation of the maintenance works performed so far. Ventilators, about 51 of them already maintained, and as you see, there was about 111 delivered to the sites. 34 patient monitors have been maintained. So patient monitors, about there were 66 by that time to prepare this PowerPoint. ECGs, almost there was 5 or 6 ECGs were there, and 4 of them already maintained. Defibrillators, suctions, IR thermometers, and oxygen concentrators. And price-wise, it's not right now. It says like 10 million, but it can go out to $1 million right now because there is a lot of equipment maintained after this presentation is presented for the management team. And doing this maintenance with the emergency maintenance centers in Addis, we have encountered majorly 4 issues. The first one is capacity problem. Because those equipments are collected from the hospitals. This is due to first, the biomedical technicians and engineers do not have the enough capacity to do those board-wise maintenances. That is a bit advanced maintenance. That's why we go for ET, where they maintain aircrafts, where they design cards, PCB boards. So that's why we go there. So there is a capacity gap in the basic electronic wise. The other one is workshop tools. There is a detected gap there because most of the equipments which are brought to the sites do not have a major problem, but a little bit testing, then cleaning, calibrating, and such stuff. So if they got those workshop tools, they are capacitated with the knowledge of doing that, then we are able to solve this problem. The other one is a tiny guideline to follow, which is a decontamination and disinfection of those equipment. I'm happy if biomedical departments are here because they face a major problem while decontaminating and disinfecting those equipments. It was not a big deal, but there was another gap that is identified during this maintenance work. The other activity is beyond this COVID equipments, medical equipments. We were working on oxygen plants, oxygen plant maintenance, and to capacitate our human resource there. So the ministry already spent about 10 million birrs to supply the spare parts for those sites, majorly the Jimma site in Jabara, Walleka, and Aider. And those sites already awarded with average of 1.4 million per spare parts. So this is also to capacitate those facilities with oxygen supplies. And there is also a gap here that we have identified during working this spare part availability for oxygen plants, and the capacity building also it requires, because most of the time, the medical equipment and medical device, the sector is going advanced, so they have to get up to date every day. So they need this capacity building works. And the other one is the ministry has engaged itself supporting the regions, managing donations for this, mobilizing resource for this, like some partners like Assist do. We are collecting and mobilizing resource for that. You can see here on the presentation, a club, Rotary Club already financed this much amount of spare parts for oxygen and patient monitor, mechanical ventilators, and other supplies. I don't know if this is visible for you guys on the first one.
Yeah.
There's a,
Yeah, it is.
Is that visible? Okay.
Yes, it is. Yeah, brilliant.
There's also additional support that we are expected from Rotary Club. Some of suppliers already they are keen to support us. Then they give us some spare part for maintenance of oxygen concentrators, but not too much. But their offer is appreciated. You can see WMG Biomedicals, they give us for free, they come here. Then they were also participating in mechanical ventilator maintenance and spare part and servicing availability at Ethiopian Airlines. And this is what I talk about: oxygen plant maintenance, and this is how we can grow our capacity of availing oxygen status in the in the country, then our potential and actually how we can grow it up concerned with this COVID-19. The other one is we already do support for the regions by distributing those cylinders, ventilators, alcohol, under alcohol productions, patient beds, patient stretchers, and then this is also, we also have that in budget wise about $6.2 million equipment and supplies has been distributed. We are supporting the region. So in this scenario also partners are supporting us. For example, at the we have one center of COVID recovery center at the Millennium Hall. Most of the beds and the other supplies are bought by a single person. Just some partners will cover some of it. Some partner will cover the sanitation. Some of them will cover the equipment. Some of them will cover even the partitions for that. And you guys also can involve in such activity to beyond the maintenance and other activity. This is to summarize some of the challenges for activity of spare parts, accessories, transportation vehicle availability at that time, because there was a lot of work to the ministry, then all of the vehicles and then transportation was not available for us. And then we were obliged to move by ourselves, and amazingly some of the hospitals are not able to brought equipment. I don't know what's the reason. This is all I have for you guys, and I don't know if it is good, but this is all I have, and then you can ask a question.
Samuel, this is absolutely amazing. Thank you so much for sharing. Thank you so much for letting us into a little bit of what the Federal Ministry of Health, the Biomeds there, are doing in partnership with Addis Ababa University, Tech Barid Polytechnic College, Ethiopian Airlines, the academy, the workshop there, NMI. Absolutely brilliant. Just some of my personal thoughts. I think it's really inspiring to see all these entities in Ethiopia coming together so quickly, especially for biomed related support. I don't think I've seen anything like this before happen so quickly. And so I certainly have appreciated seeing this. Thank you so much for the incredible work that you guys are doing. I love the data you're sharing. I love that you guys are tracking all of these devices and the spare parts needed. It seems incredible that, you know, even Rotary clubs are stepping up to do their part in helping make sure medical devices are available and functional. Thank you for sharing some of your challenges. I do have some follow-up about the challenges later on, but Maz, would love to hear from you. I know Ashaber is on the call as well from TechBarid. Would love to hear your thoughts also about what's going on in Ethiopia with biomedical related support.
Ashaber, would you like to go ahead? Benji, maybe you can unmute him. Maybe he's on mute.
I have hit unmute, but it's being very stubborn. Maybe Ashaber is holding down the mute button, maybe.
Ashaber, can you hear us? Maybe you can unmute yourself if you would like to contribute something. The experience at TechBarid.
Hello?
Yes. Good. Now we hear you.
Are you hearing me?
Yeah.
So much.
Hello, Dr. Mas. Are you hearing me now? Yeah, it's not convenient for me to talk a lot, but I am in the journey. So I cannot add. I cannot add one thing on. I think it is a good presentation what you are heard from Engineer Samuel. As you can see, some of the equipment which are maintained in Tagwara is, as you can see, in number. So I think it is better. I think some of the accessories is not good in the local market, especially the challenge we face is without the accessory and some of the spare parts. So unless I think it is good. And the other thing is, me, as you can see from the last presentation, most of the equipment are really is collected from the scrap. Maybe it's not functional. So we can use such equipment for spare parts. So that's it. Thank you very much.
Thank you. Thank you, Ashaber.
Thank you, Ashaber.
How is it? Is it good? Are you hearing me very nice?
Yeah,
yes,
we
heard you.
Thank you very much. Okay.
Good.
Thanks, Ashaber.
Yeah, so thank you, Samuel and Ashaber for sharing experiences in Ethiopia. I think, as Benjamin mentioned, this is really amazing to bring all the parts together to be able to respond, because we have not been very active as a country in conducting maintenances, especially on ventilators. And when this happened, it was a surprise for every technical personnel on the ground, and we had to, in fact, start from the scratch. And so being able to put resources and personnel together helped us to support each other and respond as quickly as possible. And I think that is probably the reason why we managed to, as a country, to maintain as many medical equipments as possible. And I think, as Samuel mentioned, and also Ashaber, the most important challenge, I would say, we realized in this maintenance activity is how the spare part and accessory supply chain is so unreliable as a country that we couldn't even find parts and accessories, in the local market. And importing parts and accessories is a nightmare, even more difficult than importing medical equipments, frankly. So I think that's where Assist International, as an NGO, beyond supporting the maintenance activities technically, is also trying to compile parts and accessories for COVID devices being maintained in Addis and beyond, mainly in also Tigray and Amhara regions. So I would like to really appreciate and thank the support we got from Assist International in this line. Very, very important support. And as also Samuel mentioned, now the appetite for hospitals to bring their medical device to these maintenance centers at TechBarid and MI and Ethiopian Airlines seems declining. And then we also started going to hospitals in Addis to do assessment of the medical device they have and support them on the facility itself. So far we have done inventory on St. Peter Hospital in Minilik, in Yekati 12, in Ras Desta, and as I'm speaking, we're compiling the data at Dodi2, and also Black Lion Hospital or Tukrambasa, hospital. And also today we started the assessment at Turnesh Beijing Hospital. And hopefully we will also move to St. Paul. I had time contacting the Biomed. Hopefully she would respond so that we could also do this assessment so that we know exactly what parts and accessories are needed to be supplied. So yeah, it has been luckily most of us, especially including me from academia, we were relatively less probably busy from the university side activity, so that we have more time to support this ongoing maintenance activity. And I'm sure also the staff at Tagbarad, they are very dedicated team working all the time, including holidays, even just like a full-time job. Basically they are volunteering like that all the time. They are there. So, and also at Ethiopian Airlines, I've been there. I've seen airlines technicians supporting the maintenance of ventilators actively at NMI also, and also the volunteers who just come and maintain whenever they can. So this is really a coordinated, I would say, effort between institutions and biomedical professionals, and also non-biomedical technical personnel, as Samuel mentioned, who have board level, component level, electrical knowledge, who supported also this maintenance activity. So I think the credit goes to everyone who helped with supported the maintenance activities in the country. So yeah, thank you everyone for this amazing work.
Thank you so much for sharing, Mads. I do want to, give a shout out to some of the funders, at least Mads, that we've been able to bring into the mix here. General Electric Foundation, GE Foundation, Grand Challenges Canada, UBS Optimus, as well as the Elma Foundation. They've all stepped up and put some grants, made some grants available for us to be able to do the work we're doing. Unlike some of our prior engagements, this one is unique in the sense that they've been able to rally around the vision of mobilizing Biomed and conducting remote training sessions, but then even go beyond that to support procurement, emergency procurement of parts, accessories, and consumables on such a very short notice. We had to ramp up very quickly. So this is quite unique because we're, as Maz mentioned earlier to those of you listening, we are providing parts, accessories, and consumables to some of the hospitals in Ethiopia as a part of our work in Ethiopia. And we hope that more funders and more funding agencies will see the impact of this and maybe step up to support countries in this regard. With that being said, I see our Tanzania Biomed team is on. I saw Ivilius on for a little bit, and Nziza from Bugando Medical Center is also on. And so please feel free to share some of your experiences in Tanzania as biomedical engineers and technicians dealing with COVID-19. Please share what you've been up to and what your facilities are doing. And so while you think through that, Sarah, would you like to share some of your thoughts? We'd love to hear from you as well. Yeah, please jump in.
Sure. Thanks, Benjamin. Actually, it's a great point for me to come in because the last thing that you were mentioning, how quickly the funders were able to mobilize and help provide some support. We've experienced the same thing in Malawi, also with ELMA actually, and with the other consortium of funders that we use. And it's really been kind of a great thing to see. My presentation will be very brief because I just found out about it. But I think the coolest thing for me is to see how quickly the Malawi government has mobilized to assign new technicians to facilities. So quite frequently, and I know this is the norm for other countries as well, there's one technician or one biomedical engineer per facility. They managed to mobilize and fundraise to budget for 2 extra technicians per facility to help kind of adjust to the additional support that they thought would be needed. Right now in Malawi, our cases are pretty low in comparison to the other countries in our region. Whether that's because they're actually low or because we have limited testing is in question, I think. But it's been really nice to see how quickly the government has provided support for these things. And these are funded positions that will be lasting past COVID-19 as well. So it's providing additional support that's been long needed in the country, which is very exciting for us. I've also noticed, as biomedical engineers and technicians, we're responsible for the entire facility. And so with COVID-19 happening, it's been very difficult, I think, for many biomeds to focus on any other wards except for COVID-19 wards. And so that's been, I think, quite a big challenge, is ensuring that the standard of care in the other wards has also been maintained, especially with so much focus in around trying to prepare and build up the quality of care for COVID-19 potential patients. So those are some of the issues that I've seen, but by and large, it's been really great actually to see how quickly the response has happened and how effective I think the response has been. So there's still obviously a lot of room for building up the capacity of the technicians that have been assigned to these facilities, but we actually just, I think, graduated the second or first class of biomedical engineers from the Malawi University of Science and Technology, and a large body of them have been provided with employment through this kind of extended funding opportunity. So all of that has been really great. I think it'll be interesting to see how it affects the standard of care for the facilities as well. I think that's all I've got.
That's brilliant, Sarah. Thank you so much. And what an important issue you've flagged, because I think we've seen that in some of our other conversations too, where the rushes to support ICU and emergency departments and oxygen therapy, and you see resources being diverted away from NICUs, from maternal and child health departments. So that's a very, very important thing that you've brought up. Thank you for flagging that. Wow. Our biomeds in Tanzania, would you like to share some of your thoughts? Musoma, biomeds in Ziza out of Bugando, if you'd like to share about what you've seen your departments do as a response to COVID-19.
Yes, Benjamin, I would love to share some of the experiences in my country.
Please, Benedicto, the stage is yours. Benedict, can you hear us?
Hey, Benjamin, can you hear me?
Yes, we can.
Yeah, definitely. I wanted to share with you a few of the experiences in my country. Well, the government of Tanzania has done so well to distribute most of oxygen therapy devices to most of the facilities. But the biggest challenge are the numbers of technicians, biomedical technicians and engineers to do the installations. That's the major challenge here, that most facilities are facing. And also, I've seen a facility having a ventilator, and when I asked those those who were attending there, I didn't see a person who was qualified to use the ventilator. So most of the challenges here, the machines have been supplied, but the number of technicians and the people to do the services to that's all I have for you, you know.
Thank you for sharing that, Benedict. I think we lost you a little bit towards the end there, but I think you were saying the supply of equipment is not the issue here. Just a lack of technicians and engineers, skilled engineers and technicians available to install and perhaps even train on the use of the devices is perhaps a key barrier. So thanks for letting us in on that, Benedict. I want to, Guna, you know, so we've heard from Malawi a little bit, and Ethiopia and Tanzania. What are some of the things that Malaysia is dealing with as far as Biomed and how they're supporting as a part of the COVID-19 related response?
What we did is like Malaysia government, the biomedical, we got a Ministry of Health Engineering Department. So they came out with the suggestion that all the ventilators, tubing, all that single use, practice that particular thing, and every PM schedule is been done accordingly. So ICU and the COVID area will be the important areas that need to be monitored. But so far we don't have any issue on spare part or anything because it's like been maintained and been following the procedure, because if anything goes wrong, the biomedical department get fined out of it. So they've been following that particular structure. So at the same time, we cannot visit hospital as you want. You need to fix appointment, and even the vendors need to fix appointment, and the biomedical have to give a green light to get into the hospital. So it's not easy task to move into the hospital as you wish. So all these are like been monitored, and you have to scan whenever you enter a biomedical department. So you got a record that you came in to service or whatever. So anything goes wrong, they're going to track you back. So it's quite not easy. And what happened is because of lockdown, we couldn't move. Only the biomedical engineers can move, included me. They give me a letter that I can move around. If they need any support, I can join. So since last week, they give a green light that we can move around interstate, but not overseas traveling. But what happened is a lot of work been done in early preparation because they've been following a schedule of PM, all that. So equipment breakdown is less, and COVID area is one of the important area. And most of the COVID case, what happened is you get a case in a certain state, they're going to bring you to an isolation place eventually. So they're going to monitor. So what happened, another thing, our cases have reduced. Like today is, we got foreign import case. That means a Malaysian in foreign country coming back. We got about 10, but the local case is only 1.
Wow.
So it's reducing actually.
Brilliant.
So that's
Guna,
what's going on.
Yeah, I've heard you talk about the quality of biomed service in Malaysia before. And I love the point you brought up, because you've been on a routine maintenance schedule anyway. That it wasn't like you had equipment that weren't functional and you had to rush to get the equipment up and working, you know. And I think that's been perhaps some of the things we've been seeing in It may be Ethiopia, Maz, and Tanzania. There's equipment that needs spare parts that aren't working because of just years of lack of a systematic routine maintenance. That a lot of the initial work has just been, okay, let's assess and try to get parts and get these repaired. So I know the Musoma Biomeds, they visited multiple hospitals, as Benedict was sharing. I don't think he got there, but they visited multiple hospitals, and now the key issue for them is spare parts, just as what Ethiopia has our colleagues from Ethiopia have mentioned. I want to maybe at this point, take a moment and hand this off to Aaron, as we come to this issue of spare parts and issue of lack of capacity that Samuel had brought up earlier, capacity related issues of technicians. And I think even Benedict had brought up that as an issue. I think there may be something Aaron may want to share that we're quite excited about. Aaron, the floor is yours.
Thanks, Benjamin. So I'm going to go ahead and share my screen very quickly. This is not a long presentation, but we do want to share a bit of an announcement with you. And before I start, Benjamin, perhaps you can share the survey link in the chat. It will take you to a different page. So unlike usual where we have a poll, you can just answer directly in Zoom. This week we're doing a larger survey. It shouldn't take you very long, but we have about 2 weeks before we'll plan our next session. And we want to make sure that we gather all of the feedback we can. So if you fill out that survey, that'll give us a good place to start. But in the meantime, while you guys are doing that, I'm going to tell you a little bit about a program that we're starting in the next couple of days. Just to echo some of the things that people have been saying, like these are common barriers, even pre-COVID, these things existed. Sometimes it's training and knowledge and skills. Sometimes it's lack of access to things like service manuals that can help you actually fix equipment. I believe Sarah mentioned that most hospitals only actually have one biomedical engineer, which means that there isn't some senior engineer to train the new people coming in. And people are kind of working in a vacuum on their own. And of course, everybody has echoed the lack of access to spare parts. And even if you have access to spare parts, you may not have access to budget to buy them. So these are things we see over and over again, really all the time. And we've tried to address some of these things like skills and knowledge through trainings like this one. We've occasionally done trainings on the ground in person as well in the past. But what we're looking at now is trying to find a way to support biomeds remotely while we're under these strict travel limitations. And what we've come up with is what we're calling AI Go Remote. It's meant to address primarily the lack of mentorship and on-the-job knowledge transfer, as well as some of the access to manuals and digital resources that we have that some people may or may not know about. So it's fairly simple. If you're here right now, you've already accomplished step 1. So you've registered for our online sessions, you're attending ECHO, you know about the ECHO trainings. Step 2 is to either find a mentor or be a mentor. And these things kind of happen simultaneously. We'll send out a form link. You fill out your name and your contact info. And then you're kind of in our system. And we'll email you with things like requests for help. If you have a request for help, we'll email that out to the mentor list. And then you can you'll be in this community where we can, exchange technical resources, exchange knowledge, work together to resolve problems, especially for people who don't necessarily have that at their own facility. And then once you are connected, either as a mentor or as a mentee, you can submit a work order to let Assist know, hey, we've started this troubleshooting process. This is where we're at, and this is what we still need. And we'll just kind of repeat that process over and over again. And that helps us on our end to see exactly where the needs are. We have these ideas in our head anecdotally, like Musoma needs, for example, zeolite to fix oxygen concentrators. We know that the team in Ethiopia at Ethiopian Airlines Academy needs more consumables or accessories for patient monitors. And we can take these things, bring it to funders and say, these are the actual needs, documented needs, and this is what we need funding to help with. So I want to walk you through some step-by-step. This is step 2, find a mentor or be a mentor. We'll send out the form link. You can see it right here in the PowerPoint. And then this over here is what the form looks like. Again, we're just collecting contact information if you're signing up to be a mentor. But if you have a very specific question and you would like to be connected with a mentor, you can select this button, and then you'll be prompted to enter some information about the device that you're working on, as well as some description of the problem or what troubleshooting you've done so far. And that will bring us to the second form. Once you've been connected and you have done some troubleshooting, you can fill in an update of what you've done, maybe where you got stuck, where you need more assistance, and if you have any spare parts requests. So again, this is the step-by-step. I'm gonna actually close out of the presentation and show you the forms. Benjamin, do you want to add anything while I'm doing that?
Yeah, so as Erin, as you're pulling that up, I just want to say that, there are other forums out there that you can find technical resources and engage by asking questions. There are email listservs you can email requests out to, and that are very helpful. What we're trying to do here is make sure that first of all, there are the ongoing echo sessions that you are a part of. So all of the questions you're asking perhaps have a touch point to you joining us in the video sessions, in the remote mentorship sessions. And then moving on from that, we will be tracking each of the issues that the mentor and the mentee are working on. And if it ultimately comes to a parts related issue, we're going to try and see how we can help get a certain part for you. So there's a little bit more engagement and attention given to this from us. And again, this is geared towards engineers and technicians who are already a part of our echo sessions. This way we have a little bit more of a personal interaction than just you firing off a question on a forum that may take months or years to get some attention. And so that's all I have to add. Erin, over to you.
Okay, just a second.
While Erin's pulling that up, Nziza, thank you so much for typing this out. I'd like to just read this out. She says, the few things that I can share with the team is not far from what Sarah was sharing, perhaps. The great focus now is in these areas important during this period. And I think it is really essential that the engineer keep improving their skills and practices to conquer different tasks, more especially in times like this. So thank you so much, Nziza, for sharing that. I know you've been very engaged in these sessions and also in the in-person training sessions we've seen. So we hope that you're able to share this with your team as well. So even after COVID, you have a stronger Biomed team. So thank you, Nziza. Erin, over to you.
Thanks, Benjamin. Okay, so what you're looking at on my screen here is the actual form to sign up for the mentorship program. So again, you'll enter your name, your email address, depending on what you prefer, either WhatsApp or Telegram are also options. And so if I sign up as just a mentor, for example, it'll ask me what my specialty is, and you can fill that out as well so that we know who to connect you to. And then if you have a question or a troubleshooting problem, you'll get some different questions here. So you can identify your problem, identify any troubleshooting you've done, and then give some of the details about what kind of device this is. And that way we can get you to exactly the right person with the right expertise. And oftentimes this may be Guna, our esteemed instructor, but sometimes we may need to branch out and connect you with someone else. And I do also want to show you, there will be a webpage that will direct you to all of these different resources shortly. But in the meantime, I just want to make sure that everybody knows that all of our sessions are online. This is the web address here, assistinternational.org/COVID-19 resources. It looks a bit like this. And if you click on the biomedical technician section, you'll be brought to this page and you can look at any of the old sessions. And as part of this, we're also actually going to be uploading all of the checklists that we've been referencing and some of the PM documentation that we've also used in our own training programs. That way you have all of the resources that you need to complete your troubleshooting activities, and you have some guides and steps along the way. I think that's all I have. I do want to allow a few minutes for questions still. If anybody has anything to add now or any questions about the new program. I see a question from the Musoma team. I was asking if it's possible to have a clinical person so that we can have his training on how to wear the PPEs. That's a great question. So Benjamin has just dropped that link in the chat again. Remember, I clicked on the biomedical technician block, but just to the left of that, there was actually a clinical block. And so there are lots of sessions about PPEs. We talked briefly about reusing PPEs, and there's a longer session on that there. And Benjamin, remind me if it's the CDC, but there's a great video that we can actually link everybody to directly. I think that may help with donning and doffing.
Yes, that was the CDC. We do have a session that we're working on that is a little bit more involved as far as donning and doffing is concerned. But to Erin, what you were sharing, you're absolutely right. Our clinical teams have, the team working on clinical sessions have worked on donning and doffing of PPEs. And so we're happy to send that link out in the chat as you ask other questions. Does anybody have any questions as to the mentorship forms that we're talking about? We'll send an email out so you are able to sign up to be a mentor or be mentored. And I see some people with expertise here to be mentors even. So people like Samuel, people like Ashaber, even our Musoma Biomeds, you know, you have, perhaps you'll have capabilities that you can share with other biomeds from East Africa that may need mentorship. So don't just think of this as something that will get you a mentor, but think of yourself as maybe mentoring somebody else, right? There's varying levels of skills. And so maybe you're able to mentor a biomed who's just freshly starting out in this field of practice. If there aren't any more questions on that, we will send the links out in an email. So please feel free to sign up, and we'll keep reminding you in case you forget. In the meantime, we should do a survey. And if you've missed it, I'm putting this link in the chat again. It would be very helpful if you're able to click that link and go and fill out the survey in as much detail as possible. We're looking at curating future sessions, and we would love to create sessions that are relevant and based on topics that you need. So as an example, don't just say, I need to learn about preventive maintenance on ventilators because we've already covered that. But if there's a specific step in the preventive maintenance that you're unsure of, ask us that question, give us that feedback. So maybe you don't know how to calibrate the oxygen sensor. Well, you put that in the request so we know at what detail we need to curate our future sessions, okay? So if you don't mind, if we can all just take maybe a quick 5-10 minutes, and if you can click on that link that I put on display. It should take you to a page that looks like this. So once again, on the chat, you'll find the forms, the link that I shared. If you click on that link, it'll take you to a page that looks like this. And I'm just going to actually fill in this survey very quickly, so that way Erin and Guna and Maz are aware of what I think needs to be covered in a future session. So in general, what has limited your ability to attend and participate? I've been fairly okay. I have no issues, but maybe for some of you, the session's too late. I'm not sure. The second question is, think about all of the sessions I've attended or watched. How valuable was the information presented? I would say it was actually extremely valuable. I've joined, and out of all the 11 sessions we've done, how many have I joined? I've joined all the sessions. Out of 11 sessions we've done, how many have you watched afterwards on our website? That's a great question. I've watched about, I think, 4 sessions. On the website. Out of the 11 HTM sessions, which have you found most helpful? I particularly liked the second ventilator session we did. I really liked the second oxygen concentrator session we did because we had the team from Musoma sharing really good pictures about the sieve tanks. So I thought that was really good. I really enjoyed the electrical safety sessions. Part of the reason was because of the case studies that were being presented, very detailed case studies from the tech product team. So I enjoyed all of those sessions there. I must say I enjoyed session 2 of the ventilator. This was when Guna dropped out and I had to try and present. And I must say I learned a lot, so.
Thank you, Majid.
No problem, Guna. In general, which segments of the HTM sessions are most helpful to you? I like the test equipment, how it is used. It reminds me of the connections. I love the preventive maintenance and the corrective maintenance. And I really enjoyed the case studies. Those were the things I enjoyed the most. Tell us more, why you selected. Other Biomed teams are working on equipment. How can we improve that? I think you can improve it by adding more and increasing discussions. What is the primary barrier to fixing medical equipment at your hospital? I do not work at a hospital anymore, so I'm not going to answer that. And I'm going to put none of these. What device would you like to see us cover in the future? I think someone had brought up PCR machine.
Yeah,
So I'm going to put that down.
Thermal thermometers, like thermal scanners.
Yes. Perfect. Oh, there's only 11 questions. That's so easy. What topics would you like to hear about in the future? This is where we need the answers from Biomed. So I would like to say issue specific sessions on devices. What I mean by that is how to, so I would say maybe for ventilator, I need to see replacement of O-rings. For patient monitor, I want to see how to wake up a battery. You know, so try to be as specific as you can in when you answer question number 10. That will help us put together sessions for the future. What country are you joining from? United, USA. And then I hit submit. That's how simple it is. And hopefully this will help Erin and Maz and Guna create a session or curate more content for future sessions. Well, if this is it, we're gonna just let you be. Please fill out the survey again. I can't stress that enough. We can't stress that enough. I want to very specifically thank Samuel from the Ethiopia Federal Ministry of Health for joining us and sharing some incredible thoughts. Thank you. Thank you, Maz, and thank you, Ashaber, for sharing your incredible thoughts as well. We certainly appreciate, and we've learned from what Ethiopia is doing. I want to thank Benedict from Musoma joining in and sharing some of the challenges and some of the things they're doing in Tanzania, as well as in Ziza. Thank you so much. Thank you to Tanzania for contributing to the sessions. A shout out to Sarah for sharing what Malawi has been up to. Some incredible learnings there as well. And Erin, thank you so much for sharing about AI Go Remote. I'm so excited to see how this continues and takes off. So I'm going to hand this off to Dr. Maz, maybe some closing thoughts on your part, and then Erin, you can close this out.
Yeah, I think I don't have anything more to add, just to remind everyone from the Ethiopian side to be ready to get the accessories and go to the second round and install the accessories, test it, and then give it to the clinicians to use it. That's very important for us to close every work order option, to close down that. So that's what I have. Thank you.
Thanks, Dr. Maz. Yeah, I won't go through the list again, but thank you all for participating. We're really looking forward to starting back up here in a few weeks. We love to hear from you in the meantime, especially if you have something specific you want us to talk about, or if you're interested in sharing your own experience again. We're very open to that as well. And with that, I think we are good to go. So we'll go ahead and close the session, but as Benjamin said, like, thank you so much for the past 11 weeks, joining week after week. We appreciate it.
Thank you. Bye, everyone.
Bye, guys.
Bye, Maz. Thanks.
Bye, guys.